So we're here today with Dr. Bradford Cole. He's one of the principals of the Cole Pain Therapy Group. And I believe you're located in, is that part of Bartlett?
It is.
Because
yes.
I know I
Just
visited
in
your
the
office.
Bartlett, exactly.
Okay.
Just in the Bartlett, but we service the entire Memphis area.
Yes.
North Mississippi and Arkansas.
Wonderful. And I know that you have a number of doctors that are part of your practice. I found that out this morning. I also toured his building the other day, and it's spick and span and beautiful.
Thank you.
And when I began to mention that I was going to be speaking with you, I think I told you this earlier, that a lot of people already knew who you and your dad were, and
Exactly.
some were patients already.
Mm-hmm. Well, it's 40 years of practice now.
Right.
Between the group and practice full-time with my father. And as you mentioned, we have a number of doctors. We have 6 doctors of chiropractic altogether.
That's impressive.
Now. So, yes.
It's
we're
impressive.
excited.
So we're here today to talk about the difference between structural versus functional care. And I did a little bit of homework on that, just so I could, personally have a better understanding. But what would you want the public to know about that, or what would you want your clients to begin to understand?
Absolutely. So most people are going to have back pain at some point in their lives.
Sure, I've had it.
It's the second most common medical issue, right behind upper respiratory tract infection.
I got to tell you, when you mentioned that this morning, because we were at a group this morning, that is amazing. I didn't realize that. That's a huge deal.
Very common. Second most common reason for somebody to actually seek out some health care is because of back pain. It's the second most expensive healthcare problem once it's gone chronic. And so when you have the ongoing back pain, it can become very expensive because of the imaging and the medical bills.
Sure.
Lost time from work.
Yeah, that's what I was going through my head. I used to be in HR, and I can just imagine, how much time is taken from productivity and production.
And not just in the industrial settings, but actually from office workers too.
Oh, yeah.
Being that office desk jockey, riding that computer, it can be really tough on one's back and cause some issues.
Yeah, the ergonomics of that desk, and I remember having neck issues because I started out when computers were, I'm dating myself, first out, and I sat for hours like this with my head turned. So there's a lot of issues. I was surprised, though, that was number 2. You also mentioned another statistic that was surprising about it being behind diabetes as one of the most chronic or
most expensive. Once that spine problem is chronic, it can be very expensive moving forward because we have a lot of treatments that are there, but there's no one treatment that's just smashingly successful for it. And you had mentioned making a difference between the structural spine problem versus a functional, right? Structural versus functional.
Right.
How it looks on the x-ray.
Okay.
Versus how it actually works.
I see.
And being able to differentiate that is really critical when it comes to managing this appropriately, and even just thinking about it and conceiving of it, and understanding our spines appropriately. It's so very common that someone says they have episodic back pain, their back hurts, and goes out periodically, and they attribute it to a diagnosis of scoliosis that they have from a long time ago.
Okay.
Or they attribute it to a diagnosis of a slipped disc that they had imaged maybe 5-10 years ago.
Right.
In the scoliosis diagnosis, the slipped disc image on the MRI, those are structural explanations.
Yes.
But the thing is, like, the scoliosis is there all the time.
Yeah.
Even on a good day or a bad day. And then a potential slip disc or a disc problem that's really remote, it's from a long time ago, those things heal up.
Yeah.
And the x-ray and the MRI looks the same on good days and bad days.
Right.
And so that's
it has to
not
do
the
more
factor.
with what it's affecting and your ability to function.
Exactly. Absolutely. So what are those other factors that go into this condition? And we call those functional issues, how it actually works.
Right. And I was reading up on it a little bit, and when they talk about like scoliosis, for example, the structural, some people have a diagnosis that they have to live with and have issues because of that. And then they did describe some of the functional being environment, things that you're doing or not doing on a daily basis that could affect or have you become to have a curved spine.
Absolutely. And so any like a movement specialist that you go to, go to a surgeon will do surgery.
Right.
A pain management physician will apply prescriptions or injected medications, and those are excellent at the right time. Of course, we have we're blessed in our community to have some excellent physicians that do those things here. When it comes to the functional side, how it works with chiropractic, physical therapy, rehabilitative care, then we can actually look at what movement factors are there that are contributing to the pain. And one really important thing to recall, or just to conceive of, is if there is a factor that makes it worse, that indicates...
When you say factor, I'm going to interject it once in a while, because what do you mean by factor?
So if...
Like something that's happening? Or?
No, so if your back pain is noticeable with sitting for more than 20 minutes, like I can't walk...
When does it happen? When does the pain show up?
If I carry a backpack, if I sit too long, sleep too long, walk too long, stand too long, bend too much, those types of movement-related exacerbating factors.
I've even heard of people having like too big of a wallet, right? Is that a fact? I mean...
That can be an external factor, absolutely, because we can...
It restricts your movement,
Yeah, we consider move a certain way and not realize it.
Right.
But, so if your back is worse with sitting on a wallet or sitting sideways, then it does imply then that we can also design a rehab program to improve it.
Right.
So if there's factors that make it worse, then there is a strategy to make it better.
Right.
And that's addressing not what it looks like on the x-ray, but instead addressing how it works.
Sure. I think, I know myself, I haven't had a lot of incidents, but I recently did. And as soon as it happened, I actually thought it was a kidney infection. I mean, that's how it felt. But it ended up being my back. But I was thinking, oh my gosh, I'm going to go to a chiropractor, I'm going to go to a physical therapist, and this is going to be a lot of work, and this is going to be hard. And the opposite was true.
How so?
Well, they gave me gentle ways to work up or work into relieving the tension and relieving the muscles. Simple things like just having a small ball and squeezing the ball, just to get those, I guess, hip flexors, or I'm not a physician, so I don't know what I'm saying as far as parts of the body, but just to get the parts of the body, I guess, that support the back moving in the right direction.
It sounds like the right exercise at the right time.
Yes.
Which takes a detailed examination.
That's exactly it.
But the right movement, the right intervention, the right stretch, the right adjustment, the right decompression, the right exercise at the right time.
Yes.
It's really important, because we should see pretty quickly the pain needle move.
Yes.
So, if there's a curve to your back, or maybe there's a weakness, what I hear that's really sad, it's really unfortunate, is a lot of times people will think, I've got to correct the curve, or I've got to strengthen the weakness before I'm ever going to start to feel better. Yeah. Like it's going to be months of work.
Yeah, that's what I was thinking, oh my gosh, it's going to be hard work, it's going to be a long haul.
But that's the wrong goal, or the wrong assumption, is because if there's a weakness or a tightness that's contributing to your back pain, if it's the right exercise, targeted or the right treatment, it's not going to fix it immediately. No. But we should reduce the pain very early.
It did. I was amazed with just the small movements that and I think some people go toward just medicating, to deal with the pain.
I love medication for a short-term solution. As soon as people start using it long-term, then there's some issues with long-term use. And sometimes, if it's like a short-acting med, like a naproxen, Advil, anti-inflammatory, for 6 to 12 hours of relief, to dose it non-stop, it's kind of like taking electrical tape and putting it over that check engine light in your car.
You're still there.
Yeah, you're just turning down the signal.
You're just like
turning on the signal and then not fixing the underlying, those underlying contributing factors.
I know. When I see my husband has chronic issues, I'm going to have him come see you. But when that happens, he does less. So his idea of, dealing with it is to do less. But I think that's probably what got him, from sitting a lot. He has an office job. It probably contributed.
Yeah.
So to do more of the same that got you there.
Well, that was, unfortunately, years back, that was the number one recommendation.
Yes.
So this is
rest.
Going back into some history, it was 2 weeks of bed rest for back pain. And then there's a researcher, a medical doctor named Gordon Waddell, who revolutionized, he introduced the back pain revolution, revolutionized how we manage back pain issues.
Right.
And it went from, hey, anti-inflammatory drugs and 2 weeks of bed rest.
Oh my goodness.
To now, hey, let's get things moving again in the right direction early in.
Right.
So we don't do less for too long.
Right.
Because as you know, if you concede too much movement, you do less and less.
Yes.
Pretty soon, weeks, months, years go by, and now
you physically can't.
You're weaker.
Yeah.
Exactly right.
Yeah.
You just can't.
So I liked how you described earlier today your diagnostic approach, because you just mentioned alluded to a couple times that it's getting the right exercise or getting the thing that's going to move that needle closer to no pain due to alleviating the functional issue. Explain a little bit how why that's important, because that was a big deal this morning when you spoke.
Absolutely. And so it all starts with a conversation.
Okay.
Because we need to know when it hurts, what makes it better, what makes it worse. Look at those factors.
Right.
And then also have a really good understanding of your goals. I've got some patients who their back hurts after 20 miles of running, but they're a marathoner. Their goal is to fix that. I've got patients who can get out of bed because of their back pain.
Sure.
And their goal is obviously to be able to get out of bed, move around, get back to work, or whatever that might be. And so we have to align the expectations with your goals first. And then we also have a conversation that rules out the dangerous things. You mentioned maybe it feels like a kidney infection.
Right.
And so, there are dangerous causes of back pain. We need to rule those out.
Yes.
And then we're left with this movement-related, very common but very significant spine pain issue.
Right.
From that point, then we go through some movement examination to confirm what hurts and why it hurts, and then to kind of zoom out a bit, look at overall movement to see what factors are contributing. Could be a tight ankle, could be a core inefficiency or weakness, could be a variety, a wide variety of things. But understanding exactly what's contributing to the pain then allows us to then design a rehab roadmap to your goal.
Yeah,
to get you back to where you need to be.
Yeah, what will alleviate the problem and get you where you want to, mobility where you want it to be. Exactly.
Absolutely.
Yeah, I know that my mom had an accident as a younger person, and one leg is shorter than the other. So it changed her gait. It changed the way she walks.
Yeah.
And so every once in a while, she needs some help with her back.
It'll flare up.
It'll flare up on her.
And the amazing thing about this is that our bodies are always trying to find that balance and equilibrium.
Yeah.
And you can have high performance individuals that have that leg length inequality or that structural scoliosis.
Right.
And it's super interesting how a lot of times that is not their main cause. It might be a factor, but it's not a death sentence to always hurting.
Right.
To have that structural issue.
The message is don't give up. If you have back pain, there's answers.
Absolutely. Don't attribute it to something structural.
Right. Or an incident that happened in the past and just say, now I have to live with this, or a diagnosis from the past.
Absolutely. Because there's so much that can be done.
So what is a common thread that you see? Like if you could broadcast out to potential clients that they you find yourself repeating or you find yourself sharing often, what would be something or a few things that most of us need to hear?
Absolutely. So once you have that roadmap, that rehab plan, and that could involve nutrition, some target medications, chiropractic manual care, massage therapy, manual therapy exercises, any of those tools in the toolbox.
Right.
Once that plan is there, then push for getting back to that goal.
Okay.
Don't concede anything, but push towards that. Because the most liberating thing I'm telling people all day long is that you're free to go do the things you want to do.
Right.
If it's pickleball, if it's going and cleaning the house or caring for a loved one, whatever that might be, you're free to do it.
Right. I think that's smart. I mean, just stepping back for a minute and talking about goals and wanting to get somewhere, there's only so much, beating yourself up, whipping yourself, verbally or whatever to do something that's going to work. I mean, it's short-term motivation. But I think if you have a vision of where you want to be, right, and how physical you want to be, and tie it to things you want to do with your family or activities that you want to do, that means you're working towards something.
Exactly right.
I think the mental, state of mind is a lot better if you have a goal in front of you. And the fact that you speak to them and get an understanding of what they want to be at.
Sometimes it's hard to articulate too.
Yes.
And so especially if you've been suffering for a while,
right,
it's good to slow down and think, if I didn't have pain, or if my pain was 50% less tomorrow, what would I do differently?
What would I be doing? Yeah.
And think about that, because honestly, a lot of times we've forgotten. It's been so long.
Sure.
Think about what would you do differently.
Right.
And then once that plan is in place,
right,
then coordinate with your doctor about it. And then a lot of times I'm telling people, look, what we're doing in the office is we're taking that parking brake off your car.
Yes.
And now you can start driving.
Yes.
Versus if you ignore a strategy to figure out what's making it better or worse, and then you keep trying to put that thing in the third gear with the parking brake on, it's frustrating.
Yeah. And I think, when you feel that pain, then you begin to limit your thoughts, right? You begin to say, you get invited, to go somewhere or do something, maybe a cruise, and you got to get on and off the cruise ship, and you're thinking to yourself, I can't do that. So even before you start, those experiences that you've had, if you don't have a game plan and you don't have a goal in front of you and reaching towards something, you're already having that limiting behavior, or even thoughts on what you can and can't do. I mean, how small? People's lives can get pretty small when they have back pain.
Absolutely. We describe it as contracting. So if it hurts to operate widely, then we do less. And then it sneaks up on you. Then you're weaker. You do less, you do weaker. But to have those goals, I mean, a lot of times I'm talking with a patient in the office, and they have a trip coming up, right? Or they're going to be caring for grandchildren coming in for Christmas. And that's their reason to get things feeling better.
Sure.
They have a goal in mind. But honestly, the beautiful thing is they come into the office with that goal because they have a hope.
Right.
That things could actually be better.
Absolutely.
And oftentimes they're surprised how quickly we can turn things around, but it's just doing the right things.
Is there anything else? I think that you also described this morning a little bit about the scope of care that you give. It's chiropractic, but you have other services as well.
Correct, yeah. So we have a team of chiropractors, but we recognize that a lot of people get better with a variety of treatments. Some people just need one type of treatment.
Right.
Other people need a multimodal or variety approach.
Okay.
And so we have excellent doctors with chiropractic, manual therapy, manipulation and adjustment of the spine in targeted and comfortable ways. Our doctors are also trained in dry needle therapy.
So
using small acupuncture size needles to clear out muscular dysfunctions. And that can be very effective if that's what's needed. Also corrective exercises, the strengthening, the stretching. We have two excellent massage therapists that do medical massage by prescription here in the office. And so we can have that done in a very professional setting there too.
Okay.
In addition to laser therapy, nutritional changes that help to heal things up.
Right.
The interesting thing, in the world of non-drug, non-surgical spine care, if you're going to a place that is doing the best things, it looks pretty similar, right?
Okay.
And so, it's not that there's only one practice in the world that does it the right way.
Right.
But any practice that is providing comprehensive spine care
Yes.
and following the research and putting the patients first, it's going to look pretty similar.
Right.
And that's what we do. We want to put the needs of the patients first.
Right. It helped me understand, or everybody understand, the connection with the nutrition. Because that when you think of back pain or physical therapy or massage, my first thought isn't nutrition.
Absolutely.
What's the connection there?
Well, pain only comes from inflammation.
Okay.
All right. So let that sink in real quick.
All right.
Pain only comes from inflammation. Inflammation long term causes degeneration.
Okay.
All right. We all know people
right.
who are maybe like late 40s, early 40s that look like they're 80.
Okay, sure.
And then we think about, well, how'd they get that way?
Yes.
Probably a very inflamed lifestyle.
Right.
Smoking.
Sure.
Ding-dongs, ho-hos, and funyuns for the diet, right? Living life hard, not thinking positively, not getting good rest.
Right.
And so that causes gray hair and wrinkles on the outside.
Right.
Right? It also causes gray hair and wrinkles on the inside. Inflammation, arthritis, autoimmune issues, all of that host of problem. And so the big thing for our society is this inflammatory nutritional trauma.
Interesting.
Right? And so we can inflame with what we eat, we can deflame with what we eat. And so what we do in the office is we educate and promote an anti-inflammatory nutrition. It focuses on whole foods that are pro-healing, have the right caloric makeup, because most inflammatory, unhealthy foods, high calories, so too much calorie, not enough nutrition, with a net inflammatory load. Okay. So that's kind of
does absorption of the nutrition, is that factored in, or?
Absolutely. So when we're going through it, if there's an inflammatory bowel issue or malabsorption issue, then sometimes we'll want to use some key supplements to help to heal that gastrointestinal pathway too. Sure. We can help to heal that because it'll help to balance that.
Because I've heard that, from functional medicine, that they talk a lot about not just what you're eating, which could be healthy, but if you're having trouble absorbing the nutrients from what you're eating, due to some other issues, that could be a problem too.
Those get complicated, but there are some nutritional solutions. And then, when it is complicated for those people, they know it. Because they've tried it. It's very rare that someone comes in and they're surprised that they're eating unhealthy. Right. All right. Instead, we kind of know what's good and bad, but it's helped to go through that conversation and then present those other prioritized solutions.
But I think when you describe it the way you did, and it was a rhyme, so inflammation causes, I don't know.
Yeah, the inflammation causes that degeneration.
Degeneration. I like that phrase. But I don't think people think of it that way. I mean, as a layperson, I think there's good food, there's bad food. I need to eat more of the good food. But I don't really think in terms of, I think more in terms of calories or weight. I don't necessarily think of inflammation.
Correct, yeah. And so
and it all makes sense now that when you describe how nutrition ties to that.
Absolutely, because the body mass index, the weight, extra weight gain, that's a side effect, it's a byproduct of being overfed and malnourished. And the thing is too that excess fat cells are highly inflammatory. They really are. And so that causes a whole host of issues. Yes. And so when it comes to anti-inflammatory nutrition, neurologists love it for brain health. Sure. The cardiologists love it for heart health. Right. The ophthalmologists love it for eye health. And then from a spine care world, we love it for joint spine health.
I thought of all those others, but I never made the connection with inflammation of the spine and the joints and all of that. It totally makes sense.
Absolutely.
I was heavier and I had foot pain. I lost 10 pounds and miraculously the foot pain went away. And it was like light bulb went on, There's a direct connection with, obesity and pain.
Absolutely. Yeah, because of the inflammatory component. A lot of people think about it from like a mechanical compression component. Yeah. It really has a lot to do with that.
I was looking for a new shoe to wear or orthotic because I was just thinking my foot. Sure. But unrelated, I lost 10 pounds and it just like it never existed.
And if you think about, well, what did it take to lose the 10 pounds? If you trace that strategy back, it was likely pro-healing and anti-inflammatory in nature.
Well, we've got about a few, maybe 3 minutes left before we end our time together. Is there anything else that you would like to share?
Yeah, I just want to encourage your audience that when you are caring for your family, and when you're operating in times that can be stressful, to just take the extra time to spend on your own health too. All right, in order to make sure that things are good for longevity. Because there's a couple of reasons why people seek out our care. And one is for pain control. Another is for longevity. We want to be more durable for the long haul.
To do more longer.
Yeah.
And statistics have shown, a lot of other people we've had come in have said, often the caregiver leaves us before the person being cared for, because they're not taking care of themselves.
I can see it because the heart's there, and a lot of times your body and the logistics of just being able to carry on can deteriorate a bit.
But on a positive note, we want to be able to do more for longer, and be feeling good. So thank you, Dr. Cole. I really appreciate you coming today and sharing what you know.
A lot of fun.
Thanks.